Hi, Janet.
Hi. Wait a second. Oh my God, I can't see anything. Okay. Okay, this thing is recorded. I'm so bad with technology. I
No
remember in high
worries.
school when they said you could go into computers. I'm like, I'm in science. I'm exactly up. I'm in science. I just do labs. What do I need a computer for? Is how that went.
That's yeah, you can't avoid them in this day and age. Yeah. But fortunately they are getting more user friendly as time goes on.
Yeah. Yeah,
Yeah.
but I also honestly makes me nauseous. Too
Oh,
like I
interesting.
just get nauseous. Like I'm like, okay, I'm the person who can read on a computer until bed and then just go, oh my God, this thing's making me sleepy. I really gotta go. Boom,
Yeah.
I'm out.
Mm,
So just a
better than
second,
a
I'm gonna let my
bedtime
dog.
story.
Yeah, just like not that I like doing that. Just a minute. Oh, okay. I gotta go. Oh, so I'm so sorry I wasn't more present this past week. I really
Oh,
expected to be,
right. You just had
right?
other things coming up in life?
Um, well, other than like, Facebook and stuff, like that whole thing for me,
Was
not
a challenge?
going back and forth. And then you like, yeah. Technology, the hugest challenge. Probably the big one, like one of the biggest things standing in my way,
Right.
if not the biggest thing, I would say.
Oh, interesting.
Other than, yeah, the science that I don't know because I've only had one surgery.
Right.
Yeah.
Right.
Because for after
Yeah.
that, for me, honestly, hun, I would have been you, I feel. Because the lack of care was utterly astounding. In the
Mm,
hospital, it was horrific. And I was at in Toronto. Thank God I made that decision. The decisions I made completely based on communication with amazing healthcare providers in the community, right? Were the decisions I made about my body. So, but what happened after was horrific and now comical because I can I'm the girl that makes funny of my trauma. So what are you gonna do? But I love
yeah.
to laugh. So,
Yeah,
you
you have to be able to deal with it in a way which makes sense for you. So
hmm
what would you have preferred differently if you could go back and have a different type of experience? What would have been better for you?
this, I mean, I did it all myself because of myofascial release, right?
Right, right,
Um,
right.
I've already, I mean, as much as, and now this is the very challenging thing for me. I want to hear about you to a certain extent because I know my journey and I've heard yours to, how you got here to decide on this because I feel like I have a calling as well, obviously, in ways that it has been this long. I'm still in the game, despite how little I am. Um, and yes, of course, I have carpal tunnel. Thank you, Pharma, for telling me that. But am I going to do the surgery? Yeah, no. Right? There's so many things that we're told we have. It doesn't necessarily mean you have to run for the surgery. That being said, interestingly enough, recalled, right? So it's a really fantastical look for me because I'm still living it. In that
Right.
I, as a myofascial release worker, I'm not gonna cut into me again. I'll fix what ain't broke.
Yeah.
Me as a woman and what I've pared this down to in health, because it became a lifestyle change when you have three boys under the age of 10. Doesn't become
Right.
pharma. What can you give me? What can you give me? Save my life. Not for me.
Right.
So, that really as a massage therapist and a myofascial release therapist, right? And a warrior. Oh well, and three kids under the age of 10, boys, all boys, right? Kept me very, very active. So, my takeaway would be this, in fact, it's been a very busy time, obviously, and where I said to my husband, ex-husband seem to be like, it's really difficult when you have um um I said to him, had I just gone the farmer route and just did everything my doctor told me, you know, and or if I had survived cancer financially, I wouldn't have survived cancer. Like if I had just decided to survive cancer by doing what I could afford, it was all of our peeps. It was physio. Like for me, I had to do tamoxifen for 5, but my naturopath mimicked it after that, and we're all, on from that. So, and because of all, I, so funny because there's such an appendage. I don't even, uh, um, because of the great, practitioners around me, and then knowing what I know about my body, it was because of what we do that I am thriving in ways that doctors have, oh my God, like, oh my God, that, you know. Now I was at I was lucky, 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 Princess Margaret, all in one 8-hour surgery, right? They
Oh,
put
all one
they
time.
cadaver flaps. It was you don't tell a girl like me blind study. Nancy Drew herself, right? Blind study. I'm like, yeah, 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 me. I'm the girl who does something to half of my body. See what the other right. So I'm like, okay, let's see what's gonna happen here. Right. So when they said blind study, I was like, I'm in. And then yay, I got not the old standard way, but cadaver flaps, implants. Like it all came so quickly, right? When they said I wasn't going to tell my kids unless I was going to be sick, which to me is radiation and chemo, right? So that's why I made the decision I made, and I haven't looked back. And I think at Princess Margaret, it's what they do now if they can, right? As far as that's what, and because I'm back every at least I think every year to see Dr. Hopper because of the recall. So it's very, very, very important for me to make sure that I can see that there's no inflammation anywhere, that I can feel and have, complete range of everything that I do. It's an interesting look for me. I'd love to know what other massage therapists are after double mastectomy and a broken arm, are still practicing in ways that I know I have to go beyond the table,
Yeah. Yeah.
right?
Yeah.
Because I love what if there's anything happening in COVID, because I have all males in this house, I realized how much I missed the female part of my work,
Right.
right?
Yeah.
That's where I got my female. Well,
Right. Yeah. So you're looking to expand your practice then? You want to get into helping people with going through these types of surgeries so you can be one of the people that's helping them the way that other people helped you? Is that right?
yeah. Yeah. Although yeah, certainly. Although, it's, yeah, what a smattering of people. Now that you say that, as I've gone through this journey, right, of what I call surviving myself. Um, because that's where things become difficult over, the cost of healthcare. Like
Mhm.
I would go into politics and have Canadian healthcare, oh, give it a choice. You get to do this or you get to do this with your healthcare dollar because look at what these people have done. This is what they
Mhm.
do. This is what
Mhm.
these women
Mhm.
do as
Mhm.
we connect and, hold hands. And, I feel like I'm only one part of the wheel, right? Like I know, in fact, what's stopping me a little bit, although I love all the content, in specifics, right? Like especially about the surgeries, like the various types of surgeries, like the knowledge, right? Complications, right? I've got a lot of breast augmentation, got some breast cancer, um, but have never complicate, just really what goes on in the chemo and rad's body, right? Specifically with, it's difficult with myofascial release because, I call it the tracks of my tears, right? When I'm already light touch. Like when they were talking, I don't know what the girls that were, the therapists were talking about. And I had MFR and I was just dead. I'm just like, what kind of MFR are you getting? Right? I don't kill anybody unless you don't drain well. Right?
Yeah, some people, yeah, they approach it in a different way. Some people take more of kind of a Rolfing style where they're
Mm,
doing more working on the deeper layers of connective tissue and a more, very intentional approach, not intentional, but like a
well,
firmer touch,
and I gotta say, this is exactly where I went. Like I went from I'm going to be a physiotherapist to having the best reflexology appointment of my life, right? That I thought I'm going to be a massage therapist, and I went in it. And Kathy Ryan was she was treatments back then, anyway. And I went about it total physiologically, total science,
Mm,
total because I had been at Western at school for nutrition and psychology. Like it's been a fascinating look, how this is all, that's why I sit here at this point to look at what has happened in my life, how I ended up where I am, that I feel like I really need to help,
yeah,
right?
yeah.
Because there's times when my boobs were like getting red and hot, and I knew and the nurses, well, I don't touch that, that's for your doctor. I'm like, that's what you're here for, right?
Mm,
So I'm
yeah.
pumping my own, right? Pumping my own, I had 4 drains, pumping my own drains because I'm just like, I can tell something's wrong and you're not going to do anything.
Mm, mm, mm.
Right. And just stuff that you recognize even in the healthcare practice right now in Canada. There's a lot of people that don't know what they're doing when they come to very specialized, again, another facet of talking, they need to be very specialized.
Mm-hmm, mm-hmm,
It could be.
mm-hmm.
And anyways, it's so difficult because I haven't taken the time to, well, I don't think I could access them, what you have made for clients, or surgical patients, and I haven't, all that you have made on the mastectomy guide. I really tripped over it over Kathy Ryan, and then Facebook is how I came to
Right.
you.
Okay. Okay.
Right? And
Yeah.
so,
So Kathy and I are doing a course together in October, which is the
okay.
Science of Scar Tissue course. And that's really wonderful. We did it for the first time last year, and then we're going to do it again this year because it's so much fun. She's wonderful to teach with. I absolutely love
Yeah.
it. So
Yeah.
if you're interested in scar tissue development, that's a good one for you. So let me ask you, which direction do you want to take your practice? So what I hear about your practice is right now, you do mainly myofascial release. You've got a lighter touch. You've got your own
That's the
personal
problem. I don't
experience.
always have a lighter touch, right? So I
Right.
do,
But you
right, in
want to
that.
have a lighter touch
I
more
mean,
often?
what happens is I have old clients that are used to heavier touch,
Yeah.
right? And
Mm-hmm.
I
Yeah.
and yet new clients, as I'm phasing out, or phasing out, marinating things a little bit. I am leaning more towards you know, yeah, helping women. It's really interesting with myofascial release and what I can feel because I've done so much self care on myself, having had three
Right.
three C sections as well.
Right.
You know,
Right.
so the amount
Yeah.
of care I've done on myself really gets me in the brain of other women with other women's bodies,
Yeah.
touch and where, you know, and it's okay, hun. So for you, you'll understand this from the going from the other side, what I wanted to say, physiological massage school. Of course, with cancer surviving, of course, with, you know, mental health, um, um, COVID, right? I was self-caring, of course, like every therapist. And I became a yin yoga instructor because as you lie in yin, I want my clients to be able to go lie in yin, their positions so that we can take it to the table, so that they can quiet on the table. So they don't have to keep talking to me when I need to quiet, when I need to be present. But where do I feel like an imposter? Because yoga isn't at the gym and just the last stretch of the class, and I got to go because I don't have time for stretch. There's a spirituality bit that for me coming back in that I know in there in my treatment table is exactly kind of my opportunity to help women quiet. in a breast cancer vein that is necessary, right?
Right.
Doesn't
Yeah.
have to involve weed at night or a glass of red wine.
Mm-hmm.
Ridiculous how much
Mm-hmm.
the
Mm-hmm.
ability to go to substances when it's really about quieting your mind. So I want to be able to take my clients off the table, everyone have their bolsters at home, be able to do a class, and everyone just go off to bed if they want, like drop into a class. But
Right.
I feel my education in even Yangsta yoga, right? Like as a yogi, I do yoga, much like I lift weights.
Mm-hmm. Mm-hmm.
But that is not what yoga is. And so
Mm-hmm.
especially the yin part of it for me has really gone, I'm missing. That's where I feel like an imposter in my
Right.
yoga, like in that part where, oh no, Jan, you can just teach that. And I'm just like, but I feel such a greater depth of the only time I was able ever to meditate was on a body scan. I don't
Mm-hmm.
meditate going up mountains. I go meditate going in the body
Mm-hmm.
and
Mm-hmm.
blowing up my pain so I can get curious
Mm-hmm.
about it. Right. I,
Mm-hmm.
I try to teach people to that. So
Yeah.
I'm,
So the mindfulness training, it sounds like that's something that would be very useful for you.
I did that through OHIP back then. Like I did do, yeah. Everyone has various different ways of teaching, right? And I love that. It's how I found, yin. That's how I found, my type. How I, but um, I feel my practice is lacking in science content for me, the understanding of the surgeries you're talking about, let me see what I wrote down, the knowledge, surgeries, complications, oncology, um, that is my main concern. Don't ever want to hurt anybody, right?
Yeah.
And yet, when
Mm-hmm.
I was a heavy-handed back then in the day, did I?
Mm-hmm.
Sure. Like with my non or my I can change the world, warrior,
Yeah.
like, oh, I feel this, watch me,
Mm-hmm.
and, moving. And so now I understand the allowance. Now I
Mm-hmm.
understand more of the patience. Probably took kids and a dog for that. Um, so that, I mean, my hands on, I'm quite confident in, other than, yes, someone coming into my, like, me going, "Oh, I haven't had a lot of real oncology, like different. I've had a lot of breast augmentation, lumpectomies, smallish lumpectomies, not none of, some major scarring. No. Right. So do I welcome that? Yes. Solo learning again. But do I want to make sure that I'm covered on, everything to what's coming in my door when it comes in my door, that I have confidence right off the bat
Right.
is huge.
Yeah.
And
So it sounds to me like what you're looking for is information about the surgeries so that you feel really confident with what is actually happening underneath the skin.
Mhm,
With you want to know about the complications so that you feel like I'm a very safe therapist. And then altogether, you feel like I'm not going to hurt anybody because I've got some good knowledge. I'm confident with my hands. I understand how to work with people. And I want to be able to expand my skill set a bit so that I can offer massage and yoga and have them together to help people feel, settled inside, a nice quiet mind, and you kind of have a vision for how you want to move yourself forward. But
mhm,
there's some gaps in your knowledge
mhm,
about the surgeries and the complications and what science has to say about this, like healing with this population.
mhm.
And so that's knowledge that you're looking to get. Is that right?
Yeah, yeah.
Okay, good.
Um, love the supportive community bit. That's always hard. Every time I go
Yeah,
to my fascia release seminars, I'm sorry, you get so fired.
yeah,
I get
yeah,
so fired up being with my like-minded.
yeah,
Right? And
yeah, yeah, yeah. It's
that's
good.
That's my favorite. That's some of my favorite.
Yeah, me
Um,
too.
Word of mouth has always been my referral, like always. Other than now, like other than now wanting to niche, thinking of niching, but it really is hard to kind of take myself away from my because it's busy. But what was I gonna say there? Oh, education. Like I want people to quiet on my table.
Hmm.
You don't often get to charge for, oh my gosh, your myriad of knowledge that's in there, and yet you can't keep talking while they're on the table as they ask you questions. Right? I need to quiet, and I would like to go ding, and nobody talks, is what I'd like to do.
Mm-hmm.
Unless you want to tell me about your experience as we go along, or I ask
Hmm.
you a specific question.
Hmm.
So, eventually, I would love that for them to want that to happen
Hmm.
too,
Hmm.
right?
Hmm.
In ways that, yeah, I guess needing my space to say who I am before you walk in my door,
Right.
right? That this is what I do and this is why I do it. I know, because I think being a breast cancer survivor, um, there's a lot of scared women that come in my door.
Yeah. Absolutely. Yeah. And they need to know that you're a safe space, you're a safe person, and that you
And it's
can help them with what they're
and,
looking for.
and it's actually a little bit what's turned me away is the, energy, you know, of I mean, there's the warrior energy, but we're not all of that ilk.
Mm.
And you want to help empower and show, I guess for me, no, no, that I can show you that I can touch your pain and augment it, move it. We know it, we know it's not cancer. Like when you are a cancer survivor, every freaking pain you have, you think it's cancer. It's
Mm.
like, oh my God, I got pain in my shoulder. Has it traveled? Like, oh my God, what's going on? Well, I guess as a therapist that I go and make sure it's under my umbrella of tolerance,
Mhm.
right?
Mhm. Mhm.
That it's not something that's weighing on me, that I like to get it off my chest, as I like to say. I don't
Mhm.
like to
Mhm.
house anything in here unless it's,
Mhm.
love of my work and what I'm, what is siphoning through me needs to be clear.
Mhm.
So
Mhm.
I know that I would love for that, I get tasked, to that a lot about the website. And I say to that person, well, when was the last time you had your hands on somebody and helped to heal them? Right? I'm not a website builder. I don't want to spend my time doing that.
Mhm.
My son is, we've talked about it a little bit. And yet, they're just, oh, it's so easy. You just need to do this and this and this. But I take it very seriously because I only want to splat it there and I really don't want to touch it.
Mm. Mhm.
I'm not a social media girl. I'm not somebody, I want to do my work. I want to keep
Yeah,
my,
so it sounds like word of mouth referrals is what you're most comfortable with. You like the people side of it rather than the tech side of it, and you're happy for people to pass your name along. So maybe some language. It sounds like in the gaps that you've got, some language on how to talk about doing this is an area that you'd
I have
like
that there language for
filled
sure.
in. Yeah. And then you'll
Yeah.
be able to share with your patients, this is what you're doing, and then they can help you spread the word and recommend people to come and see you. And
It
that's
does
what you're
happen
most
really
comfortable with.
organically, so I'm not worried about that at all. But
Right.
I do, but I do like I found it now because of it being core curriculum and the four courses, right? Core curriculum. Um, that
Yeah.
because I knew you explained that, and that's what your stamp is, right? Because that's what's interesting too, right? As I've taken a look, trying to find just the surgical stuff,
Yeah.
right? Like just the science of it, like of it, because it's ever
Yeah.
changing, hon. This was new, like new 10 years ago. The
Yeah.
flap, the, aware, and let's be true, every person's different. He gets in there and oh, he took my lat and he attached it to my, like the pec that he attached to. What happens? With like even like what happened, like what happens in workouts, what happens to serratus anterior, and why I only do a half push up so it'll take my scap and glue it down to my back. So everything isn't happening through, you know,
Yeah.
through my,
Yeah.
so there's just so much exercise physiology that I've come, like, I don't know, so much that you just
Yeah.
come to know through wanting to
Yeah.
keep working.
Yeah. So I have another option other than the academy, which might suit you. So if I can, if this is a good time, I can share that with you.
Mhm,
Might
mhm,
be very
mhm.
useful for you. So it's the three main courses that are the backbone of the core curriculum, not the integrative cancer care one, but the other three. So there's foundations,
Foundations, level
level
one and level
one,
two.
level two, and that
Mhm.
is a comprehensive intensive. It's happening in November, starting on the 22nd, and it's 6 days, and you get all the science. You
The second,
get,
third in November. Okay, six
yeah,
days. Oh yeah, 6 day
starts on
intensive.
November 22nd.
Okay, November 22nd, six
Yeah,
days.
so it's 2 3-day weekends, Friday, Saturday, Sunday. So November 22nd to 24th,
Okay.
and then November 29th to December 1st.
Mm-hmm.
And this is like the main vein. You know how you were saying, like, I just need the science. I'm comfortable with my word of mouth marketing. I feel like I could use some help with my hand skills so that they're a bit lighter, but really I'm quite confident with my hand skills. Um, and I've got, I want to help people quiet on the table, like all of that you're going to get in this comprehensive intensive. So I think it might be the route. That's out of what I'm hearing from you. It sounds like it's the route. It gives you the the direction that you're looking for from what I'm understanding. Like, you want to know about the surgeries, you want to know about the complications, you want people to know that you're a very safe therapist, that you're ethical, you've got good language skills for being able to describe what you're doing, and you want to be able to bring some of this clientele into your practice, but you don't want it to be your whole practice because you still got other clients that you want to continue to work with.
Well,
So
mhm,
this sounds like, I think this would be a good option for you. It's not the full
mhm.
academy, but it's the backbone. It's the core curriculum, three of the four courses in the core curriculum.
Okay, and but see, I mean, then because I do need the fourth course, right? Like
Yeah,
integrative
which you
cancer care.
would, yeah, and I will be offering that as a standalone course
Did
at
you
another
do?
time.
I haven't looked ready yet. It's there because I couldn't get on it. You didn't do it with the Ontario. Did you do the Ontario? Somebody
I
did.
did recently. I did a webinar with Ontario recently. I did a 90-minute webinar.
I think I
Yeah.
joined, and I couldn't get on. I couldn't get on, but it was taped,
Uh
right? And
yeah, yeah,
so
you got a
then I saw
recording
it
of
was
it.
you, and I'm like, oh, I'm gonna talk to her anyway. Um, so I
Yeah,
started to watch it.
yeah.
Um,
So that's some information, but I've got a whole 1-day integrative cancer care course, which you would be able to take as a standalone course in
it's a
future.
1 day integrative cancer care.
Yeah, and it's just focused on breast cancer. It's not all different types of
Okay.
cancer.
Yeah,
Lots
yeah,
of
yeah, yeah.
oncology um, instructors do kind of an overall, like all types of
Hmm.
cancer, but this
Yeah.
is just breast cancer,
Okay.
which sounds
Good.
like for you, it's pertinent.
Yes.
Yeah,
Yes.
yeah.
Okay. Where did I put
And
that? Okay. Oh, oh, sorry, hon. I just want to. And sorry, what were you going to say?
it's a more affordable price point, which is something that
Yeah.
you mentioned at the beginning.
Well, yeah.
Um, yeah. So it might be a friendlier way for you to be able to get all the information. Not I don't mean friendlier as in nicer. I just mean
No, I know.
more
I know.
more
I mean,
accessible.
because as therapists, right? As your own, everything costs, like everything. As a, if I worked for with a, with somebody, then it might be different. But everything you pay for is on your own. And I'm, really trying to get to an expert level in myofascial release to a certain extent because it is, you know, it has kind of been my bread and butter.
Yeah.
Um,
Hmm.
um, Although funnily enough, in school, I don't even know why I took it. And I decided at that time I couldn't do it because it was way too light. I've got my Vaughter MLD
Oh,
first
that's
level,
very useful. Yeah.
right? I'm just like, oh my God. Yeah. So now I'd like to get the MLD training just to have, fully, because
Yeah.
that's because I had they put a blood pressure cuff on me for the whole of my first ever colonoscopy at 50, and I ended up with lymphedema in my arm.
Oh, great.
That was not
Mm,
great. So I dry brush and danced my way to that out.
very good. Very good.
Right. So
Yeah.
okay, so but having said that, what I did like the other part on, like maybe it's or okay, level two, was I also oh, and I have to make sure I ask you because I bought something off your site and I don't know how to access it. Okay, templates. That's kind of
Uh,
interesting to me.
yeah, the templates are very useful. You get a lot of that information in the comprehensive intensive. It's not quite as spoon fed to you as it is in the academy, but you still get
Oh,
quite a
that's
lot. Yeah, you still get a
because I
lot
was
of the
gonna make up my
information.
own. You're like Janet, you can't invent the wheel. There must be something out there.
Yeah, yeah. So
Right?
you get access to the templates that we created in JNAP through
Mhm.
in the comprehensive intensive, and in your handbook, it's got all the language for your treatments and your informed consent and your intake forms, and you just need to copy paste it into your whatever your system is that you use for booking. So, do you use paper or digital?
I'm just starting to do digital because I'm trying.
Yeah,
Paper. I'm
well,
still
whichever way
paper.
you use, it's yeah, so paper.
I
So,
would
but you
like to
would,
send out my case history so because they my case histories are long and
yeah,
sorted when I start asking questions, as you can imagine. So
yeah,
I would like a long and sorted case history, right? Because they don't know I'm going to ask about their surgeries. They don't know I'm going to ask about actual accidents
yeah.
that occurred.
So, yeah, and when you're working with this population, it's good to have more specific intake form that
Mhm.
actually reflects the experience that this person has gone through. So you can
Mhm.
ask about the surgery, whether they've had lymph nodes removed, whether they've had
All of that.
chemo or radiation or multiple revision surgeries. You can ask about those different specific things that you wouldn't ask for the general populace. So
Yeah.
we give you all the language for that. But you just need to copy and paste it. So if you're say you're making up a Word document that you're going to print out and give to your people for paper, then
I
you
can
would
copy
just,
and paste. That I can do.
yeah, yeah, you can just
That
copy
I
and
can
paste
do.
it into your Word document, and
Okay.
then you just yeah, from your version of your handbook, or you could just type it up. If you get a paper handbook, you can just type it up, and then
I
you
would
got all the
do that.
wording there, so you
I
don't have
think
to
more so
reinvent
is
the
the
wheel.
case history going out early enough for people and then for me to get it back. That's the
Mm,
only time I might, or I guess sending out exercises, and I guess eventually you probably will use it more, but
yeah,
little by little, I'll just take a
yeah,
little bit of time.
yeah,
Okay,
yeah,
how much
and
then, hon? Oh, sorry.
so that I was going to say my theme is always progress, not perfection. So it doesn't have
Mhm,
to be perfect. You're just
mhm.
taking steps forward. And the more that you do it, the more that you can refine and
Yeah,
kind of keep improving as you go along. But if you wait until you're perfect, you'll never get
I
anything
know.
done. It will
No,
absolutely stymie you. So
no,
progress, not perfection.
I think you've just helped me. Like I've been so meaning to do this, right? And yet just with the healthcare challenges, even deciding whether to get these out, right? That I was having
Yeah.
such skin conditions. Like, how do you have
Right.
skin conditions and how can you work, right? But
Yeah.
it ended up in an
Hmm.
allergy to essential oils because I'm an
Oh.
essential oiler,
Mm.
right?
Yeah.
So,
Hmm.
anyway, so that's not even able to use those in practice. So, just like so many things, like where you have so much this umbrella that you're kind of, pushing things out from under the umbrella. I guess the universe doesn't want, for that. Like it just,
Yeah.
and then people keep coming in my path like that. I was like,
Right.
oh, how long has this been going? Has this been going on, right? So, okay, MG treatment library, 6 months. Okay, when you were talking about prizes and stuff, and sorry, I would have been so maybe next time I'll be so much more be able to because I'll do it better. But that MG treatment library.
Yeah. So that's a like a video textbook. It's a whole bunch
Mhm.
of little short videos on treating this population. And once you've taken the comprehensive intensive, then you can subscribe to it. It's $28 a month. And then you can have access to all those videos. And I keep developing it as time goes on.
Mhm. Mhm.
So
That's cool.
you
Okay.
can access that all the hands-on techniques through the video library.
Okay. And okay. Treatment library. So you can always have that. Like you can do that as long as you're paying $28 a month. That's always there for you to use.
Provided that you've taken the comprehensive intensive first.
Yes, like that's the smaller one you're saying might be better for
The
me.
smaller one.
Yeah. And
Yeah.
treatment library, what is the key? Second one. 60 intensive. Okay. Oh, so like I do like I'm a big in-person person, like I just said. So you guys are out. The only thing you're offering, this is all online on the Mondays. And
The comprehensive intensive is the 2 3-day weekends.
Yeah.
One after the other.
Yeah.
But the academy is all on Mondays.
But they're all always online.
Those two are online. The in-person course that I have, which is in Victoria, BC, is with
Scar
Kathy
tissue.
Ryan, and that's on
Kathy.
the science of scar tissue. And that's a 2-day course in October.
2-day. Okay, so they're completely separate things.
They're separate
You don't
things.
have in-person training.
Not at the moment. I will at some
Can
point.
I bring you to Ontario? Why don't I just get a whole bunch of therapists? Why don't I get it going in Ontario? Get Kathy has some. She taught here. She must have some
I'm sure she'd be up for the travel. And I've had requests to come to Ontario before.
Like I love being in the energy of.
Yeah, I understand that.
Right.
But I need at least 24 people before it makes it viable.
So maybe I do this first and then we go there. Maybe I do this and then, right? Because there's so much work on, like it's too much.
Know.
It's overwhelming.
Yeah.
The amount of work there is.
Yeah.
Honestly.
Yeah, I understand.
Right. Yeah. So, and yet I do want to also, other mastectomy massage therapists. I need to know, how's it going? How are you? How's it going for you? For all the stuff I have happening in my fingers, for all of it, right? That I wonder, hey, like, I don't know. I guess that kind of community is not out there either.
Well, it is in our Facebook group. So if you can deal with Facebook enough to be in that group,
more, right? By doing it.
Yeah, you will. And you don't have to surf Facebook all over the place. If you can go into that group, you'll meet lots of like-minded people who are all into this kind of thing. And they love to like describe what they're feeling under their fingers. They want treatment plans. They want recommendations, what product. I have a patient who has a hard time getting up off the floor after her radiation. What do you suggest? Like different, there's always different questions going on in there.
Granted, eh? Yeah.
Yeah. Mm-hmm.
Okay. So the Facebook group.
Yeah.
Okay,
and then if you take the comprehensive intensive and you're into practice and you're like, oh my gosh, I have this patient who's come in, she's 3 months post-op, she had a single mastectomy on one side and a lumpectomy on the other side, I'm trying to figure out what to do with her, then you have a place that you can ask those questions. So you've got resources there to help you.
Yeah. Stay connected. Okay. Okay. So what are the differences in the prices of the courses then, hun? Or is it on there? Is it somewhere that I could read? Or
the academy, the full academy is $4,800 plus a $500 commitment deposit. And the comprehensive intensive is $1,800, no deposit. And the science of scar tissue is $598.
So that's $598 with Kathy. And 1,800 all online. Okay. Okay.
Except for the science of scar tissue one.
Or science of scar tissue.
Yeah.
And you're not thinking of doing it in-house in Vancouver? Are you in Vancouver?
I'm in the Okanagan. I used to be in Vancouver. I did the comprehensive intensive last year in person, which was wonderful. That was terrific. This year, I'm just doing it virtually, but I might next year do one in person. I don't have anything planned at the moment, but it's percolating.
Okay.
Yeah.
Okay. So no money down. It's in November. We're online. And that 6-day intensive, hun, did you say that will help, or the templates and the marketing stuff, is that in there too? No. The
The
comprehensive
marketing is in the academy.
academy,
Yeah, yeah.
right?
But
Right.
you do get all the wording for your charts and your um, intake forms, and you get some like the body diagram templates on Jane app. If you use a digital platform, I would definitely recommend Jane app. It's excellent. It's user friendly, and they've
Yeah,
got great
everyone seems
support.
to be. Everyone
Yeah,
seems
they
to be using it,
yeah,
so
because
makes it
it's
easier.
really it's worthwhile for sure.
Yeah.
And
Okay.
if you have questions, they're really good at answering your questions. They've got great support. So that's really good. So then, yeah, there's different templates on Jane app that we give out, which are just for this population because I kept finding there's no resources. There's no resources. Everywhere I looked, I was like, there's another gap. There's another gap. And I just wanted to fill in all those gaps. So I've been creating them as I've been going along.
Yeah. Well, and I found, yeah, lots and lots of gaps, but it was just starting for me to get so overwhelming as to where to start.
I
Right.
understand.
And
Yeah.
so the self-care bit was what it is for me. And yet it does play into all our stuff. And yet
Yeah.
crazily, I guess that stamp you have, hun, is, I guess for me, maybe one of the only place, like, where else do I get that? Where, or,
Yeah.
right? You're the only one that is specific to, and
It's
I get
true.
it. We have to have a
Yeah.
niche. It's just like healthcare is overwhelming,
Yeah.
right? Especially for me. There's that part of the mental the mental health aspect of cancer, right?
Mhm.
And like this whole um you know what's trapped in the the emotional scar tissue of cancer,
Yeah.
of right, is
Yeah.
what ends up on the table, right? And so in so many ways, so many layers, why even the yogic, a spiritual look at things, at least is an umbrella for all the various different religions that are coming in when you're a spiritual person and want to honor everyone's.
Yeah.
You know what I'm,
Mhm.
that
Yeah.
as a therapist on the table, there's that spirit, the energetic, you know, the energy there. It needs to be, it's been crazy for me trying to help some of my girlfriends who've had breast cancer after me,
Yeah.
right? So that's where I've stepped back
Mhm.
because I just know me. I
Yeah.
don't know you. And I'm not going
Yeah.
to say I know you.
Yeah. Yeah.
Right. So
Fair. Yeah. So helping within your personal boundaries, what it is you feel like you've got to give, and making sure that you're taking care of yourself all the way through. So you're not pouring yourself out too much and, losing yourself in the process. And
and
you're
then
able to kind of,
protecting yourself as well. It's a very
yeah.
difficult population that has a
Hmm.
lot of grief
Hmm.
that you have to be able to work through.
Yeah.
So
Hold
go
space
through
with. Yeah. Yeah.
and hold space. Yeah, for
Yeah.
sure. And it's not
Hmm.
always easy.
Hmm.
So
Hmm.
that, I guess, this backdrop for me would go, okay, at least I'm confident here. This other
Hmm.
stuff is all really just navigating life as
Hmm.
it comes at you.
Hmm. Hmm.
It feels like.
Yeah.
Um, and yeah.
All
Okay.
right. Good. So do you feel complete? Like you've got the information that you're
I do.
good
I
for your
mean, I
next
guess I
year?
feel layers, hun. Like I do
Yeah.
feel layers of that. At least if I can get the science cancer stuff, I can continue. Um, I want the marketing in a way that, as I said, like a landing page.
Yeah.
Here she is, who she is, right? But
Yeah.
beyond that, and then the Jane app. Okay, go book,
Yeah.
right?
Hmm. Hmm.
Um, just that seamlessness, because I know my practice got out of control because I just did not have you know, those, just constantly phoning and texting your
Hmm.
clients. When you're on
Hmm.
the phone and you think you're boundering 5 minutes and
Hmm.
somebody needs to
Hmm.
talk for an hour, what massage therapist hangs up,
Hmm. Yeah.
right? On that
Yeah.
time, right? So yeah, I
Hmm.
need to
Yeah.
give it that time,
Yeah.
allow that time and space.
Yeah.
Okay.
Okay.
Now you were a yogi first, right?
I was.
Have you got to run,
Yeah.
hun? Just want to ask about you a little bit.
Yeah, I have another call in a
Oh,
couple
okay.
minutes, so I'm gonna have
Okay.
to run, but
Okay.
what would you like to know about me before I go?
No, I guess I just, I know that you said that you're a yogi first, that you were in energy work, right? And you did Reiki first. And then, and a lot of like energy workers do legitimize or at least get billed under massage therapy, right? Like
Mhm.
um, allow for the marination of all your tools. And I
Yeah.
guess, so I guess, so 13 years, have you got kids, family, married, right?
Yeah,
All of them?
yep. I have a 24-year-old. He's out on his own, doing his own thing.
Yeah.
Yeah, yeah, he's really wonderful. Yeah, so I've been like 25 years in the healing arts, and the last sort of 14-ish have been massage therapy. So I came to massage later than anything
Yeah.
else. Like,
hmm
yeah,
hmm
yeah,
But it's because of the energy work that you were.
yeah, yeah. I thought it would be a good fit. It would build on the skills that I'd already developed as an energy worker
hmm
and as a yogi, and it would, yeah, it would match really well, and it has. And had because I started meditating like 35 years ago, and then I started the energy work and then the yoga, and so I brought all of that into massage, and I'm really glad that I did, because
hmm
massage without that whole component would be a very different experience. Yeah.
When you said that, I don't know where you said that. And I wanted to like poke Kathy Ryan, right? Going, yeah, you know what? We never had that class. We had nothing close to that class, right?
Right,
Because she's
right.
so science
She
and
is
so
science. Yeah,
treatment, right?
yeah,
But that was a long time ago. So I
yeah,
hope, well, everyone needs it more in their life. So
yeah. She's still very science. She loves the science.
yeah,
Yeah,
yeah, she's a
yeah,
great teacher.
yeah.
She's a great teacher. Anyway. Okay, hun,
All right.
I think I'm good.
Okay, well, I'll
When,
send you a follow-up email with
okay.
this information, and then I'll send you the link to register, so you've got it all in one place. If you decide the comprehensive intensive is what is for you,
Is there
then
any paying it?
yes, you can do 3 monthly payments of 600 each instead of one 1,800 payment,
Okay. And
if
that
that's
can
better
start
for you.
when we start the court. What does that, or okay, yeah,
No, you would need to
come on,
start that early because
I
it has to
guess.
be done by the time the course comes
Or it
around.
starts, right? Three
Yeah,
times $600 a month.
yeah,
And it's,
yeah.
and that when, okay. I think all right, November. Okay, well, if I
November.
have any other questions, I can,
Absolutely.
right?
Yeah, absolutely.
Okay. All right.
All right.
Thank you so
Okay, we
much
will
for
chat
the
with you
time.
soon. Thanks for your
Okay.
time.
Okay. Have a
Bye
great day.
now.
Bye.
Bye. Hi, Tanya.
Hi, how are you?
Very good, thank you. How are you?
Good, thanks.
Good. Thanks for your flexibility on the time. I appreciate that.
No, actually, because I'm 4 hours ahead of you, it probably was even better. I was able to squeeze in
Oh, good.
another appointment today.
Amazing. Excellent.
Yeah.
Great. So, you were at our recent 3-day course, right?
Yes, I unfortunately I had the migraine, so I didn't actually wasn't there live, but I've been watching them.
Okay, good. And
Yeah.
how has it been landing for you?
I am so excited.
Amazing.
It's, I mean, when you talk about what is my why, um, I got into massage therapy because I lost a bet.
Uh, a bet?
A bet, yes.
Okay,
So
okay.
for almost 30 years, I was a behavior consultant specialized in neurodevelopmental disabilities.
Oh, interesting.
And so going through massage, when you were talking about your first 3 years in massage, it so resonated with me because after the third semester of my 6 semester program in Ontario, I was miserable. I was working because I was working at a massage clinic as the receptionist. I just kept seeing people come in and out of there. And it was basically, it just felt like everybody's day was back, neck, shoulders, back, neck, shoulders, back, neck, shoulders, back, neck, shoulders. Ooh, look, a knee injury, back, neck, shoulders, shoulders. I, I wanted myself in the head. I was literally for death rather than going back after 2 weeks in between semester 3 and semester 4.
Great.
Semester 4, my first off-campus placement was at a school for kids with neurodevelopmental disabilities. And at first I didn't want to do it because I didn't know if I could not be a behavior consultant and stay within scope of massage therapy. And by the time I left that day, I was so jazzed. I was so excited. This is what I wanted to do. And that's how I created my company. I don't know if you noticed it on my emails, Unique Mobile Massage, spelled
Yes,
YOU hyphen.
yes.
So it was creating things go into people's safe space where they feel comfortable and where they feel can be vulnerable and creating the massage that works for them. And for some reason, within that same time frame, I just knew that I also wanted to do palliative massage. And was frustrated that at school our breast massage was wasn't even an afternoon. It was like a 3-hour class
Mm,
of instruction demo on me, my entire class being what I bring to the party. Um, and because I'm such a kinesthetic learner, I'm like, I need you to do it on me for me to understand the process better. But that was basically it. And some practice. If people were comfortable, you could practice on other people. And that was it. And so when I've wanted to do, so I've been picking up anything and everything I can on extra information and extra techniques, etc., for oncology massage. And I do have a number of palliative patients. I have been hesitant to start doing the breast and mastectomy and because I just don't have the experience and wanting. So that's when I saw your program. I'm like, I need to get more information and need to talk with more therapists who do this, specifically breast massage. I live in very rural Nova Scotia. I am the only massage therapist within 2.5 hours from
wow.
me. I'm 2.5
Wow.
hours southwest of Halifax.
Okay.
And so I travel I have quite a wide range that I've chosen to travel in. And I'm the only mobile massage therapist. I'm probably, as far as I know, one, if not the only massage therapist who focuses on palliative and neurological care.
Right. Yeah. Both special focus skill sets as well. So I can see why you called yourself Unique Massage. Yeah, it makes sense.
Well, and I sort of talk to people, look, I'm meeting you where you are at. And doing this in a way that is going to work for you. So for someone, like I have different tables that I bring with me. Some of them are just, they hook, it's like, looks like the face cradle that just on a table, because they may be in a wheelchair. They may not be comfortable enough to get up and down off the table and that
Sure,
much
you can.
movement. Oh,
We
yeah, there you go. You
okay.
froze for a sec.
Yeah, you froze as well. I
Oh,
missed
did
some of what you
I?
said. So
Um,
the last I heard, I said I can see why you call yourself Unique Massage, and then it froze for me after that.
Oh, yeah. I mean, basically, I say to people, I'm meeting you where you're at,
Right.
and meeting your needs. So I have different tables. I have my main table that I travel with is really heavy, but I won't ever go anywhere without it because it has the tilt.
Mm,
So if you are, even just for women with larger breast tissue in general, the first thing I do when they go supine is bring it up a little bit so they're not being throttled by their chest.
right. Right. Yeah.
Um, so then even post mastectomy, post breast augmentation surgery or reconstruction, it's more comfortable for them as well.
Yeah, for sure.
Like when I started planning this whole business, those were all the kinds of things that I started thinking about.
Cool. And how long ago did you start this business?
Uh, I've just been practicing now 2 2 years.
Okay. So
Yeah, April of 22.
and you just got out of school 2 years ago and you went right into mobile massage? You didn't have anything in
Uh,
between?
well, no, I had COVID in between. Um,
Oh, small detail.
yeah, my last 5 weeks of school were when the entire world shut down.
Oh, right.
Thankfully, I went to Humber College where they were incredibly creative to make sure we could graduate. But then the CMTO didn't even run exams for a year.
Oh, so you had a big gap.
I had a big gap, and then we moved here to Nova Scotia. And so, yeah, I started up. So, yeah, I graduated 2020 and basically 2 years of not being able to practice.
Challenging.
And then went straight into mobile.
Okay. And so you're pretty happy with the mobile part. You feel like
I will
this is
never have four walls the same every day in my life. Because it wasn't just back, neck, shoulders, back, neck, shoulders. I just knew that if that's what I was going to be working in that kind of clinic setting, and the same four walls, the same friggin' trigger point posters on the walls all the time, I was just going to become bored, really complacent. I was worried I was going to stop really listening to the patients coming in and out the door. And, you run the risk of, okay, well, I'm just going to sort of phone in my effleurage now. And
here.
and I didn't want to do that. I mean, I'd spent 30 years. The main reason I loved being a behavior consultant was it was constantly challenging and creative. Every minute
Right.
with the same person was totally different.
Yeah. So yeah, I hear that you're a lifelong learner. You love to,
Yeah.
keep bringing new information in, keep exploring new
Yeah.
horizons, and you love to continue to develop yourself. You've had a few areas you wanted to go, but you felt a bit restricted, like you didn't have the knowledge, you didn't have the experience to be working with breast directly, even though it's been on your radar as
Yeah.
something that you wanted to work with. You're attracted to palliative, you're attracted to neurological, and you like to really meet people where they're at. So you can meet them like literally in their home and also
Yeah.
metaphorically where they're at inside of themselves, right?
Hence the name Unique.
I love it. Oh, that's great. Yeah. So if you were going to project yourself a year ahead into
Mhm.
your ideal scenario, you're coming into summer 2025, what would that look like for you?
I would love to see at least, I'd love to see the balance change in my practice from sort of more general population, maybe that becoming sort of 30 to 40% of my patient base, and that 60% being far more oncology, palliative, breast care, and neurological focus.
Okay. Love it.
So I've already started researching to put a business plan together to get some extra funding, and to help promote, more than anything, getting into some of the hospitals in either direction of me, for breast care and breast massage.
Oh, I
Because
love it. Good for you.
there's nothing out here.
I can imagine. Yeah, it's scarce at the best of times. And then when you're in a more rural location, it's like crickets. Yeah. So you would be that person. You would be the
Yeah.
person that everybody would be looking for. Yeah. Love it. And then other than feeling the hands-on experience and just, understanding kind of how to work with the breast patients, what gaps would you say do you have between where you're at now and where you want to be a year from now?
I'm finding the bigger challenge in terms of getting all those type of that patient base that I really want is getting to the right doors to promote the value of what I bring literally and metaphorically to the table. What is the value of massage therapy for someone during cancer treatment? What is the value, and how do we, for me, it's who do I need to talk to? How do I need to get that information out there, um, to help support? I mean, you probably saw it yourself, the number of doctors, and they don't think about massage therapy as part of healthcare.
Not really. No.
It's
The
rubby,
odd
rubby,
one
feel
does,
good, and
but
that's about it.
yeah. The
Yeah,
odd one is open, but they're more the exception than the rule at the
yeah,
moment. But we're trying to change that with these
yeah,
programs so that they're educated as well, because they have a very specific part of the journey, and their skill sets are really needed. But the
yeah.
whole aftercare rehab part, it's not really their wheelhouse. And so for them to understand, oh, there's a whole other demographic of healthcare professional that can really add some substantial benefit in this phase, they need educating on it as well. So it sounds like for you, you want to be able to reach out and provide that education and generate that awareness that this is actually a thing.
And especially I have in the last 2 years, was another reason why I lost a year sort of before we moved here, was I've been going through my own breast health concerns. So I now have to keep going back and forth to Ontario to St. Mike's Breast Clinic for mammograms, ultrasounds, MRIs. I had a biopsy in April. And I have to say, from my own personal experience, um, the medical side of the breast health journey is lacking patience, with the person in front of them. It's lacking a lot of compassion. And they're not seeing me as a person. And we have this tremendous opportunity in massage therapy to see them as a whole person.
Yeah, we do.
And to spend that time with them and to have that compassion with them. And I pride myself, I am a high assessment based therapist. I love to educate people. I'm totally geeked out on what our body does. I am the person who my poor husband took me to the living body
Body world.
exhibits.
Yes.
Body, yeah. And I'm the one taking weird pictures at weird angles just to see, oh my gosh, that's how they oh, that's so cool. Asking if we could have when they took just the brain out and they left like all the arteries of the brain. To me,
Yes.
that was this beautiful sculpture I want on my mantle. I think my husband
Right.
said no. That was a no.
That was too much.
That was where
funny.
he drew the line. Actually, no, then he bought me a blown glass brain.
Oh, that's a man
Yeah.
who loves you. There you go.
Yeah.
That's so great.
But it's being able, we have that opportunity to educate them about what's really going on in their body. What I'm
Yes.
feeling here is this. And, you know, if you've got an antalgic gait, or if you've lost one breast, here's why we need to take care of, like, you no longer have that weight on that tendon. So I want to try and prevent
Yes.
the cervical and the scapulothoracic concerns that are going to come.
Mm-hmm.
If you choose not to go for reconstruction or for whatever reason, here's the issues that you need to be aware of. They don't tell you that.
They don't.
They just tell you, we're going to cut here. Here's a small pamphlet on what to do to care for yourself. And we'll see you in 6 months.
Yeah. Yeah. It's very lacking, which is why we're putting these courses on so that we can get people like yourself. Yeah. Who are like, oh, there needs to be more than this, you know, so that
and not so passionate about it.
Yeah. And feel like, okay, you know, we can do better than this. And I believe collectively we can do better than what we have been doing. I really believe humanity can pull their socks up and people can have access to the resources that they need, and therapists can get the education that they need, patients can get the education that they need, and these massive gaps just don't need to be there. They can be filled in.
Yeah.
Absolutely. This is it's a big problem, but it's solvable.
Considering most provinces didn't even cover breast reconstruction surgery post-mastectomy for the longest time because it was considered cosmetic.
Right.
But
which is so crazy.
But a man loses a testicle.
I know. Oh, yes, it's a very different scenario.
It's immediate reconstruction. I'm like, who sees it?
Yeah, who sees it? Yeah.
Who's gonna know?
Yeah, I hear you. There's definite discrepancies
I go from a
there.
42G to concave chest. I think people are gonna notice.
Yeah. And breasts are so tied up with your sense of identity as well. Like myself as a female, and you know, having that shape. And for some people, so did you have a flat closure, or are you thinking about, well, you don't know what your situation is yet at the moment. You're in
at the moment phase. We're come back every 6 months, and we're going to keep an eye on everything we're finding in there.
Right.
Yeah.
Okay.
Yeah. But if it came down to, I'm not someone who's so attached to them. They're just bags of fat on the front. Like, unless they're being used as a feeding system, that's really all they are. It's bags of fat on the front.
Right. Yeah.
For
so
me.
For you,
but
yeah,
I get
for you,
for some,
like,
it's
a complex organ. For some people, it's like, I do not feel like myself without these, and I'm willing to do whatever it takes to make them happen in whatever form they can happen. And other people are like, I'm okay. You can remove them. I'm going to carry on. All will be well. Yeah, it's very
Yeah.
different.
Yeah. Like I'm looking at, I'd like to do breast reduction. If I have to do
Right.
to mastectomy, I looked
Right.
at that as, well, it's a little more off the top than I was planning on, but okay.
It's true. It's like I went to the barber and I just asked for a trim and like now I've got a
Trim.
pixie cut. Yeah.
Yeah. Oh, I just did that too.
That's funny. Yeah. All right. So so for you it sounds like if you're thinking about the gaps between where you're at right now and where you want to be a year from now, really understanding how to promote yourself, how to talk about what you're doing, how to help educate people on the breast health concerns. That's really important to you, and being able to get the word out there to create those referral relationships. That's something that's really important for you,
Yeah.
right? Any other gaps?
I think those are the biggest things for me. I've always
Okay.
got a confidence issue.
Okay.
And then at a certain point, I just go balls out and do it anyway.
Right. So you can feel the fear, but it doesn't stop you from moving forward.
No, sometimes I have to put a wig on and be a character to do it, but I'll do it.
Right. Amazing. Way to find your ways through. Okay, good. So what do you feel like would help you move past your gaps? What do you feel like is necessary for you?
Well, obviously getting the training, or feeling like I have enough skill just even in the small amount of breast massage I got at school. But I'd like to learn a lot more, again, going through the different types of surgeries, the different types of scar tissue, different types of post-treatment care, all of those kinds of things, so that, because I think not having gone through it personally, we have the challenge of being compassionate because it's not our experience. Like we have no, I mean, I can talk all day about my experience with mammograms. But beyond that, so having that education of knowing what that looks like, understanding those surgical procedures and what's really going on, I think makes us better therapists and better able to be compassionate and be supportive, because we may find out, I mean, you probably have that experience of a lot of patients really don't a lot of understanding what happened,
Yeah.
other than I went in, I had a D cup, I came out, not so much,
Yeah.
or there's a piece of me missing now.
Yeah.
And I'm someone, I need to know what went on, what's going, and I'm finding a lot of other people just like to have that information.
Mhm.
So I want something more specific in terms of an education, and that's why I loved your program, because you go through that with us.
Mhm. Yeah, we do the deep dive. Yeah. That
Yeah,
course was just the tip of the iceberg. It's just an
I
introduction.
know.
Yeah, so people can get a sense like, is this for me? Is this not for me? And then if it is for me, like which route do I want to go down? So let me ask you another question. How do you like to learn? Do you like to learn where you get all the information in a short period of time? It's like an intensive, and then you kind of walk away and apply it to yourself? Or do you do better with a longer period of time? You can integrate and practice and get your hands-on skills. You can ask questions. You can be in a group of people who are like, yeah, that's for you.
Ding, ding, ding,
Okay.
ding.
Okay, amazing.
I'm old now. Information does not filter through as quickly as it used to.
I hear you.
I have to apologize to patients and let them know I'm sorry. I'm at that stage where my thermostat is stuck on shuffle and my memory is on pause. So
I like your metaphors. That's good.
I'm writing a book about women's health too, and is my chapter on menopause.
Ah, very good. Well, I can't
And
wait to
that's
read it when it comes
part of
out.
why I want to do the breast massage too, is that women's health component.
Yes, yes, absolutely. Okay, so it sounds like the Mentorship Academy is really the route for you. So if this is a good time, I can go into a few more of the details about it.
Yes, please.
Okay, great. So I went over some of this in the program that we just did. Let me just call it up here for a sec. Where did it go? Sorry, my computer's being a little bit glitchy. I had to turn it off and turn it back on right before our call because it was deciding it had its own brain and it needed
Oh, that's
resetting.
okay. I once had a computer that literally had to drive around in my car around the neighborhood for about 10-15 minutes, bring it home and plug it back in again before it would work.
Oh, that really needs some kid gloves to deal with that one. Yeah.
Yeah.
All right. So this is our Mentorship and Training Academy for breast, chest, and oncology massage. It is a 200-hour program, so it's pretty intensive.
Yeah.
It does have these 3 pillars to support your learning and growth. It's got our core curriculum, which I went into a little bit, but I'll go into again. It's got the supportive community. So you've got people around you, including myself, that you can learn from and get help and support from. And then the marketing and communication. So you can get the word out there and people can know what you're doing and you know how to describe what you're doing in a way that sounds totally professional, totally ethical, and you can create those referral relationships. So I'll go into each of these a little bit more. It is accredited in Nova Scotia. It's got a certain number of credits. I have to look at my list to know the certain number, but this is the main
It's okay. We're
backbone.
changing that whole we're changing the whole professional development thing anyway. So,
Oh yeah, we just did that in BC.
yeah.
Yeah.
Yeah. I know we're looking at your model.
Oh, right. Well, BC looked at Ontario's model, so it's spreading out
Oh,
over the country.
Strive.
Yeah, they were looking at that. That's not for you. Yeah, we've got our own PDP. I think it's pretty good, actually. I like it because it helps people think about which direction they want to go and like not just being a generalist anymore, but do I actually want to focus in on a certain skill set? Yeah. But at the moment, anyway, this is accredited in your area.
Perfect.
So it's designed to move you from beginner to skilled in 6 months. So these first 3 courses are the ones that's accredited under the comprehensive training. So foundations, you get everything you need to know to be able to do ethical and professional breast massage. And, it helps you with your language, with your protocols for entering and exiting the treatment, draping, assessments, charting, like all the things that you need for your ethical and professional breast massage, plus the hand skills. Level 1, we do the deep dive into the surgeries. 13 of them are related to breast cancer. 3 are gender affirming and 3 are elective breast. So it actually, with all the subsets, it ends up being like 21 or 22 or something, but it's like basically 18 main types of breast and chest surgery. Level 2 is the complications, top 10 of them, so that you really understand this is what could go wrong. This is how I can help mitigate that. This is how I can prevent it altogether. This is what needs medical care. This is not my purview. These 3 things, these 3 courses together give you a super solid understanding of how to work with this population. And I know there's nothing else like it in the world. We also have an integrative cancer care course. This is breast cancer specific. It doesn't cover all the other types of cancer. It's just breast cancer. And it helps you understand about different stages and grades, types, difference between mammograms, ultrasounds, biopsies, treatment techniques, working with chemo, working with radiation. Like it's very it's also very comprehensive. Everything I do is comprehensive. I don't know how to make fluff courses. I probably will never
I don't
learn
either,
either.
so it's okay.
Yeah. In the marketing and communication, it's really revolving around helping you make a difference in your local community. We do want to help you draw in new clients and form those referral relationships. We do support you to reach out to the doctors and surgeons. And we do want you to give some presentations or show up at some events so that people can get to know you. Because with this kind of work, it's really important people get to know you. They need to know you're trustworthy and that they're safe putting their vulnerable places in your hands. Definitely the fastest way to make change is with community. There's absolutely no way around it. If we try and do these things on our own, it's way slower and it's way harder. So we've got a bunch of different levels of community support. Top level is your mentorship. That's me. So I give you guidance and feedback on your treatments. I actually get to see what you're doing because you send in treatment videos. Your person remains confidential, but I get to see your hand skills and give you feedback on what you're doing. There's group calls and there's personalized one-on-one calls. The peer group, such amazing people. I think you'd fit right in. They're educated, like-minded professionals. They like to help. They're progressive people. They are heart-centered people. They're good-natured. Like, it's a really beautiful group of people. We do connect you with 3 accountability buddies throughout the program. So you get an opportunity for that deeper bonding. And then it's also helpful, like, oh, I missed a day. Can you help me find this material? Or what did we go over in class that day? Or, hey, I want to do a study session together. Or do you want to do a co-working session? You know, any of those kinds of things, your accountability buddy is there for you. The community is just for the academy. It's not the Facebook group. We've got a special private community, not on social media, where it's just for people who are enrolled in the academy. And there's lots of flexible learning because, you know, we're in the modern world and there's no way we can just teach in one way. So we do a combination between teaching live and then on-demand options. So the classes and the workshops, those are all live. This is our treatment library. It's like a video textbook, and it's where all the treatment techniques are stored. You got digital handbooks, recordings if you can't make something, action challenges. That's like, today we're reaching out to our Pride Society. Today we're reaching out to the breast cancer groups. Today we're reaching out to the doctors and the surgeons, like different action challenges as we go through the program. So it's a facilitated process to help get your name out there. Lots of templates. I went over a lot of the templates in the course that we just did, but there's ones for your practice. There's ones for social media. There's ones for introducing yourself to the world. There's ones for giving talks and presentations, one for pricing. Like, there's so many different templates and all of them are customizable to your specific business. These are our main workshops. There's 3 of them for marketing. And we really focus on feminine marketing because we believe in building relationships. It's really important when you're working with this population to build relationships because that's how they know, oh, this is a trustworthy person. I already talked to Tanya. I know that she's a good person. I've been seeing what she's doing online. I feel like she's my gal. So this is what we start with. This is our foundation. In this, because I always am practical. I'm kind of a combination between a mystic and a practical person. So I always like to make sure you're walking away with something hard and fast. So in this workshop, we help you with your welcome package for your new breast and chest patients so they understand what to expect during the treatment, what are your rates, what are your, you know, all your different protocols, everything like that. And it's just customizable. So you can put your own phone number, your own website, you know, your own things like that, make it your own branding colors, that kind of thing, customizable, but it's got all the information in there.
Because that's the thing that I do now with all my clients.
Great. So this will be a good addition for your breast patients.
Yeah. Then. Like, I just had a client today, she's only ever had one massage in her whole life. She's not comfortable getting undressed. I'm like, that's great. You don't have to. And if you want me to treat gluteals, I explain, like, I go over and explain, this is what the draping looks like. This is how it's going to be. I can do it this way. I can do it that way. you call the shots. Like
Love it.
I just firmly believe that massage therapy is one of the last places in the world that a surprise should happen.
Exactly. Exactly. And especially when you're working with sensitive areas, like people need to know what to
Yeah.
expect. Yeah, there should never be any surprises on the table, for sure. Yeah.
No, and I'm on the investigations committee here, so I don't want to be in front of the
Oh,
investigations committee.
no, you don't.
No.
No. And there's no need to be. If you're clear with everybody, then there should be no surprises.
Right?
Yeah. Yeah,
Right? Yeah.
totally. Yeah. The second workshop is where we help you with your digital platforms so that you can get your message out there. So that's Facebook, Instagram, MailChimp, Meta, like being able to understand how to work with them so you can get your word out there. Then in this workshop, we help you with your brochures and your business cards so they can be tailored to this population. Same story, they can be customized to your colors and your contact info and all of that. The third workshop, we help you with your marketing systems so that marketing is not overwhelming. And you get a social media calendar, and then you can just insert your content in there. So you can spend a few
Yeah.
hours a month getting yourself organized, pre-programming, pre-scheduling, and then it can kind of just go on automatic pilot. And all you have to do is respond to your people because they're like, oh, I see you're doing this. And then you can respond to them. But you don't have to think every single time, what am I going to do? Because most of
Yeah.
us, we're therapists, we're not marketers. So we want to make it easy for you.
Yeah. I do that now. I'm just not consistent with it. I just
Right.
haven't been consistent with it. But I do, but when I do, like I try and schedule in one day a month where I just plan out a whole bunch of posts. And what I need to do is actually try and plan on paper at least the next 3 months so that I can do one a month.
Yeah. Yeah, that's good. And that's where your accountability buddy can come in handy because they can help you keep on track. And, if you're like, oh, I was planning on doing this and then I didn't get it done. And they can be like, oh, well, let's do a co-working session because I need to do that too. And then, you can stay on track that way. There's also another digital technology training program, which is not on this slide, but it helps you understand about Zoom, how to navigate the Kajabi platform. That's what the course is delivered on. Understanding, Google Sheets and Docs, and like it gives you a good overview of the programs that we use in this program so that you feel comfortable with working with them. And you can take those skills into your practice afterwards because we're in the modern world. There's no way around digital technology, and it will help move your business forward. So in terms of how this is all laid out, very broad strokes, the core curriculum, that happens every month. You get to learn the material, you get to practice it as you're learning it. So you're applying it and you're integrating it. It's not just information coming in and then hopefully one day getting actioned. This is you learn it and then you apply it with your people and you can get feedback, and that helps you actually really like take it in. It's not just a good idea that sits on a shelf. So that happens every month. In the mentorship part, we kind of split it into two parts, the first half and the second half. So the first half, you're doing your practice sessions. So you get hands-on experience with people and you're sending in your practice videos, getting some feedback on it. So you're actually getting that experience. And then you're also getting your marketing training in that first half and getting all your marketing assets like your cards and your brochures and everything. So that in the second half, when you're doing your community reach outs, you've got things to hand out to them. You've got experience already under your belt. So you feel confident reaching out to people. You can talk to them about what you're doing, what your patients are experiencing. And also in the second half, we want you to start charging for treatments so that you're making that switch between doing practice sessions, which are a different level of expectation. People know that you're practicing. You can have your videos open, your books open. They don't really expect that much, but when they become paid treatments, there's a different level of expectation. So we want you to make that transition while you're still in this container. And then also you're graduating from the program with paid clients in your roster, which is really important. In terms of specifics, The core curriculum is delivered Pacific time between 10 and 4. So for you, that would be 2 to 8 because you're 4 hours difference, right?
Yeah. Yeah.
Yeah. So 2 to 8 p.m. on a Monday. And then alternating Mondays, our mentorship group calls are from 1 to 2:30. So for you, that would be 5 to 6:30. And we do suggest that you reserve about 8 hours a week. It is a 200-hour program, so there is a time, commitment as a part of being in the program. There are a few Saturdays and one Sunday, but by and large, Monday is your day. Now, we do know, of course, life happens. It's 6 months, so sometimes maybe there's a trip that comes up. Maybe, you have to take your husband to an appointment or whatever, something happens and you need to watch it on the recordings. That's totally fine. That's why we do the recordings and why you've got your accountability buddy and everything. I do believe after you have graduated, it is appropriate for you to raise your rates, and $20 more an hour is not unreasonable. You will have an advanced skill set, and it's entirely appropriate that your rates reflect your advanced skills. So this is just a little vignette here. If you're doing 5 clients a day, it's an extra 100 a day, 400 a week, 1,600 a month. And then if you were working 11 weeks a year, it'd be 17,500-ish more per year. So the program itself, you'd pay it off fairly quickly and you'd be able to be, operating at a higher level. And there's also something in the public perception of a therapist who charges a bit more with a special skill set that, oh, this person knows what they're doing. This person, like, they can answer what I'm looking for. I don't want to go to a generalist and maybe they can figure it out. Maybe they don't. Like, I know this person knows what they're talking about. And so it actually helps build confidence and trust from your patients. So before I get into the investment of the program, is there any questions that you have over what we've covered so far?
Just sort of looking at during that time where you're doing the practical and the mentorship and watching treatments, I'm just sort of in my head going, where am I going to find, like, is it just any patient, not necessarily a post mastectomy patient? We're looking at just practicing treatment on any patient that's willing to do breast massage, or and then if that's the case, okay, and then it's
in the beginning.
Where
so we help you with that process. We give you a whole bunch of different suggestions of places that are good to go to find practice people. We give you wording and language. There's templates, like if you're putting yourself out on social media, there's templates that we give you that you can just, again, customize to your own situation. So we help facilitate that process. We don't do it for you, so you have to find your people. But so far, everybody in the academy has been able to find practice people. And then we help you time your practice people to the material that you're learning. So in the first month, all you have to find is someone who's willing to do breast massage or chest massage, but really just healthy breast massage, because in the beginning we're doing foundations. So you don't need anyone with any surgical anything in the beginning.
Okay.
Then we start with the simpler surgeries. So then when you're doing your call outs for your practice people, you say, I'm looking for someone who's had a breast augmentation or a reduction or a breast lift or a lumpectomy, one of the simpler surgeries. And then as you go along and you get into the more complex surgeries, then you can put it out looking for someone who's had a DIEP flap or a LATS flap or expanders, or someone who's been through gender affirming care, so you kind of time your call outs based on what you're learning. And same with the complications. When you get to the complications at the end, looking for someone who's had a seroma, someone who's had necrosis, someone who's had a hematoma, that kind of thing, or breast implant illness, like whatever they are. So we help facilitate that process for you.
Actually, it just reminded me, I've already treated someone.
Perfect.
With a lump.
Yeah. Yeah,
We
so they
managed
may
we
be
managed to
willing to
get
be your practice person.
yeah, we
Yeah.
managed to get back her full range of motion because it just the scar tissue was so gummed up. And I'm like,
Yes. There you go.
yeah.
Evidence, it works. Yeah. Any other questions?
That was the big one that stood out for me right now. So that's perfect.
Okay, great.
Yeah, thank you.
Yeah, you're welcome. So in terms of investment, the regular pricing is, if you want to do monthly payments, $800 a month for the 6 months of the program, which equals 4,800. And there's a $500 commitment deposit. So you would put that down now, and then you can start your monthly payments in September. Or if you want to pay in September, but you want to pay in full, that's fine. You just put that down, but there's still that commitment deposit. These prices don't include tax. There's GST on top of that.
Of course, we were all getting screwed together.
Yeah, we're all in that category.
It's the we all get screwed together tax.
Yes, exactly. But there are some ways to save. So if you want to pay in full within 48 hours, then you can save $800. So you don't have to pay the commitment deposit because you're just putting the money down to save your spot. And then I'll also take off $300 on your registration fee. So instead of 4,800, you're paying 45. So altogether it saves you $800. And then there's a few bonuses as well for people who want to do this pay in full. So there's a special VIP day, which is a 3-hour group session prior to the academy start. You get an extra video review, so there's more feedback on your practice sessions. And then also you get a home care short course so that you learn what to do to help your patients prepare for surgery, and then things that they can do afterwards to regain their movement from home.
Okay. Sorry, I'm making notes.
Yeah, that's understandable and expected.
Yeah, if you don't see me write it down, we never had any of this conversation. Like literally, it just didn't happen.
I hear you. I hear you.
Yeah. I wish I could do the in full right now. I just can't.
Yeah, that's totally fine.
And that's part of right now what I'm trying to get some of my research and ducks in a row so that I can, like, I'm thinking of going to our local business development and getting basically like the loan to take the program and show that this is why it's such a needed skill set in our community.
Yeah.
But otherwise, so when would I need to do the guarantee my spot for September?
If you put your commitment deposit down now, just the $500, that will save your spot, and then it will give you, another like 6 to 8 weeks to figure out the payments. And then if you want monthly payments, you can do that, or if you're able to get your loan and just do one full, and then you don't have to think about it again. Either one is fine.
Okay. Okay.
Yeah.
And
so what
can
are
I
you?
well, can I do the 500 by e-transfer, or does it have to be on credit card?
The system is set up to do by credit card, so that's best. But if e-transfer is what you need, then we can make that work too.
Okay. If I could do that, that would make me more comfortable right now.
Yeah. So e-transfer is better for you?
Yeah.
Okay. Yeah, that's totally fine. Okay. So do you feel like, yes, this is for you?
This is absolutely for me. Yes.
I love it.
I was decided long before this call.
Okay, good. But this call was like confirmation for you.
Yeah, it was. I mean, I think actually it was decided when when I heard your story of your first 3 years in practice. I'm like, okay, so I'm not crazy.
Not crazy. Not
I am
crazy.
not crazy that I was that miserable until I found, because they don't really teach you a lot of this, the different avenues, massage, like everyone's concept of what a massage therapist is effleurage and pan flute music.
Yes, it's true. It's true, but yes, we can bust those old myths. We absolutely can.
And so, yeah. And now, like, since I've been down here, I mean, this is clear, like, this is the stuff that we need. There's loads of massage therapists. There's more and more massage therapists moving here from out of province. And no one, I mean, there probably are more people like in Halifax and some of the more urban areas that do more of this stuff, but no one is doing it down here.
Yeah, and we need somebody. We need
We
somebody there.
desperately need it. We desperately
Mhm.
need it.
Yeah. Well, congratulations on stepping up to be
Thank
that
you.
person. Yeah, it's very
I
exciting.
don't know if rural Nova Scotia is quite ready for what's about to hit them, but okay.
They'll get used to it. They'll be like, oh, that's a thing. I know just the person to send to you.
Oh, the boob lady.
Yeah,
Yes.
that's what you'll
Yes.
get. That's your nickname. Yeah.
Yeah. I'm Tanya with the tatas.
I love it. Oh, that's so great. Yeah, you can have fun with that in all your marketing and communication. That'll be great.
Oh, don't think that I won't. As a behavior consultant, I literally created, and I wound up getting my own TV show on local cable, but I created a whole persona and character of a woman named Maud Alalepalumpi Gunverson. It's spelled just how it sounds. Oh, you betcha.
Can you say it with the accent? I totally want to hear you
Oh,
say it now.
hi, how are ya? I'm Maud Alalepalumpi Gunverson. Yeah, it's spelled just how it sounds. Yeah, Maude, Maud. Yeah, you betcha.
You're so funny.
So
Oh,
if you ever want to do a conference and have her there,
please.
because you got to be prepared though. So she always has her hair in curlers.
Okay.
She always wears like a fuchsia top, blue leggings, fuzzy pink slippers, blue eyeshadow, like
Gotta
up
have
to
it.
everywhere, and the pearl necklace to tie every ensemble together.
Of course.
And she always carries what she calls her mammy sippy cup. And it looks like one of those clear coffee travel mugs, but it's got like a wine glass in the center of it.
Oh,
And
yeah.
she's always got this nondescript dark red liquid in it that she only ever refers to as mommy juice.
Mommy juice. That's funny. Oh, can you have her show up one day in the mastectomy guide group? That'd be so funny. Oh, it's so
Oh,
good.
you betcha.
I
Oh,
love
hi,
it.
Erin. How are ya? Hi, how are ya?
Oh, it's so good. I totally love it. That's so
And
fun.
can I tell you how much I love your logo?
Oh, thank you. Yeah, I really love it too.
It's
I worked with a graphic
phenomenal.
designer. I had a bunch of
Yeah,
different ideas and we came up with this. Yeah, kind of simple, but says it all.
but
Yeah,
it's also, but even the lettering,
right?
so the pink MY, like I absolutely, it is. Like my logo, it's hands like this and a brain on the inside of it,
Ah, very good.
and there's a heart in the middle.
I love it.
But yeah, I love it's so perfect.
Thank you.
I don't think the
Okay,
hands
so
should cradle the boobies, but
you
I
could
was just
probably play
thinking that
around
for
with
my, I'm
some
like, I
kind of a
don't,
version.
yeah, probably shouldn't.
There may be some way to make that work. You never know.
And
All right. So I'll send
perfect.
you
Okay.
a follow-up email with all this
Okay, great.
info. And then, if you can send the e-transfer to Erin, should I put it in the chat here? Would this be better for you?
Yeah.
Erin at mastectomyguide.com.
ERY. Okay, perfect. I will get that off to you this evening.
Okay, amazing. Thank you. Well, once that comes in, that will trigger off the next series of things. So we'll
Okay,
stay connected. And then
great.
in
Thank
between
you.
now and then, yeah, you can let me know what's going to work better for you for the registration come September.
Okay,
And otherwise, we will see you in there. I'm excited.
I am so excited.
Yay.
I'm so excited.
I think you're gonna get a lot out of it. I'm excited for you. Yeah,
Thank you. I am really, really looking forward to this. I think it's going to be an excellent investment in my business. So
agreed.
I'm,
Agreed. It will, and it will pay itself off for sure.
oh,
Yeah.
I'm not worried about that part.
Yeah,
I know that part will take care of itself.
it will. Absolutely. Yeah. I'm excited. Okay, well, welcome aboard.
Great.
And
Thank you.
you're welcome. We will be in contact soon.
Yay. All right. Thanks so
Yay.
much, Erin. I appreciate it.
Okay. Thanks, Tanya. Bye for
You
now.
take care now.
I will. I will. You're funny. Bye.
That's what I'm known for.
Oh, that's great. I love it. All right. Ciao for now.
Thanks. Bye.